I started playing volleyball in middle school. It started getting more competitive during my high school years. I went to a small but really good public high school for volleyball, and we won 2 state championships there. So I played basketball in college for 4 years, and then I circled back to volleyball afterwards. So I stayed an extra semester in college and played on the volleyball team. And then really during medical school and residency, I really went full into beach volleyball mode and kind of picked up that sport on my own. I was really drawn to volleyball because of the team environment of it. I think volleyball is very unique in that it's a rally sport, but you have multiple contacts on your side of the net. So each contact is an opportunity to better the ball for your teammate and really set them up for success. The sport is very powerful and explosive, and putting a ball away or getting a block to win the point is super fun. And then you have a few seconds to celebrate with your teammates after. I just think it's a fun sport to play. In high school, winning 2 state championships was my earliest memory. I was pulled up to the team as a freshman, and that was one of the years we won. And it was crazy stressful for me at the beginning to try to get up to speed, but then really rewarding when we were able to win it in the end. Preventing injuries starts with good off-the-court training, so lower body focus on all those muscles that need you to get up out of the air are important. So you want to lift heavy and lift fast to focus on power. And then work on good landing technique. And then in terms of shoulder health and preventing injuries, you want to make sure that you're using your full kinetic chain to be able to get the power to hit the ball. So if you're muscling through it with just using your arm, that can set you up for injuries. And then another important thing is you want to be able to follow through all the way, because if you stop your swing too quick, what happens is the muscles in the posterior rotator cuff have to help slow the shoulder down, and that force is all going into those muscles. So injuries that volleyball players face, most of the injuries will be more on the overuse side, particularly knees and shoulders because of the repetitive jumping. It's common to have jumper's knee or patellar tendonitis, especially in the younger age groups, which is an overuse injury from jumping and landing harsh. And you can protect that with good technique, but a lot of it is managing load. In terms of the shoulders, it's kind of a conundrum with the shoulder is that it's very important to have good motion and full flexibility of the shoulder. But when you have full flexibility and you're repeating it thousands of times, it can lead to overuse injuries as well. So things like rotator cuff tendonitis or labrum tears, which can be associated with shoulder instability, can be common. So I did have to overcome an injury as an athlete, and this one actually was more recent. I had a shoulder problem as well. That was an overuse injury, so it was a labrum tear that created some instability. And I did a lot of physical therapy for it for about 6 months, and then I wasn't able to come back from it, so ultimately had to get surgery. So I'm about 6 months out of surgery now. I haven't gotten back to hitting yet, but I'm almost there. It still needs to get a little bit stronger. So I'll definitely be watching the Olympics this year. I've been tuning into beach volleyball throughout the qualification cycle. It's a really exciting thing on the American side is now we have 2 teams that are relatively younger, and they're coming out of the era where beach volleyball has been a college sport for them. So I would say the college kids now, and maybe the ones who are 5-6 years out, are really a new cohort of players who have specialized in beach volleyball during or even before college. I think you'll be seeing a lot more hand setting, a lot more play calling than the viewers saw at the last Olympics.